Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. A recent preprint study examining the Pfizer COVID-19 shot in children and adolescents has raised significant concerns about its safety profile. This large-scale study involving over 1.7 million children between the ages of 5 and 15 revealed that cases of myopericarditis, a disease marked by heart inflammation, were found exclusively in those who received the shot. The study, published in Open Safely, which is an open source medical platform in the UK, provides compelling evidence that Pfizer's shot protects against the virus for no more than 14 to 15 weeks. The limited window of supposed protection adds yet another layer to the debate about whether the benefits of the jab outweigh the risks for young people. The findings are particularly important because it challenges the long-standing notion that vaccinating children against COVID-19 will improve outcomes against the disease. Using different analytical methods, the researchers were able to gather different information regarding the effectiveness of the shot. Again, the first and most startling discovery was that the shot only gave protection for 14 to 15 weeks. By 14 weeks, the cumulative incidence of positive COVID tests was similar in the second and single-dose groups, the researchers said. In a report by the defender, Brenda Belletti, PhD, summarizes the other findings, quote, "Of the 1,262,784 children in the adolescent part of the study, vaccinated and unvaccinated, there were only 72 emergency room visits, 90 COVID-19 hospitalizations, 3 of which were critical care for unvaccinated children, and no deaths. There were 9 cases of pericarditis and 3 cases of myocarditis, all in the vaccinated group," end quote. With these findings, the UK researchers add to the confirmed and ever-growing body of evidence linking the COVID-19 shots to myocarditis and pericarditis among youth. Moreover, although the jab slightly reduced emergency room visits and hospital stays, these events were rare across all groups overall, jabbed or not. In addition, no deaths were recorded among anyone in the study population. Israeli researchers published their findings in the New England Journal of Medicine, noting, quote, "The risk appears to be highest among young men. We found that the risk of myocarditis increased by a factor of 3 after vaccination, which translated to approximately 3 excess events per 100,000 persons. The 95% confidence interval indicated that values between 1 and 5 excess events per 100,000 persons were compatible with our data. Among the 21 persons with myocarditis in the vaccinated group, the median age was 25 years. Interquartile range 20 to 34, and 90.9% of them were male," end quote. So this study further adds to the growing body of evidence that these shots cause myocarditis. And if we're saying minimal effect on emergency room visits, minimal effect on hospitalizations, no deaths, but now I have a heart condition for the rest of my life? Yeah, not safe and not effective. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.